properties could be used as a COVID-19 infection. Virgin coconut oil has been scientifically studies to have both antimicrobial and antiviral characteristics. VCO is particularly rich in medium-chain fatty acid called the lauric acid, which is known to exhibit antiviral effects. It was shown to disrupt viral proliferation as it can disintegrate the viral envelope, inhibit viral maturation, and prevent its binding or attachment. In addition, lauric acid has been demonstrated to have an immunomodulatory effect as it displays anti-inflammatory properties and increases CD4 cell counts. Now we ask, should VCO be used in the adjunctive treatment of COVID-19? The available evidence of VCO use against COVID-19 infection is presented in this rapid review published last year. Despite the growing amount of information demonstrating the antiviral activity and anti-inflammatory properties of VCO, there is still no guidelines that recommend VCO, and there is lack of information that VCO can be used as an adjunctive treatment for COVID-19. This clinical trial investigated the efficacy and safety of VCO as adjunctive therapy for COVID-19 cases. Specifically, the study determined the duration of hospital stay of the admitted patients, recovery from symptoms, secondary outcomes such as ICU admission, and the need for mechanical ventilation, and adverse events. We also determined the effect of VCO on inflammatory biomarkers such as TRP. This is a randomized controlled trial which recruited hospitalized adult patients from PGH. Confirmed that RT-PCR positive patients were in the study, but patients with uncontrolled or newly diagnosed diabetes, chronic heart disease, and dyslipidemia were excluded. Eligible patients were randomized to either the control group receiving standard of care only or the treatment group receiving VCO along with the standard of care. VCO dose is 15 ml or approximately 1 tablespoon taken 3 times a day after meals and administered orally or via nasogastric tube. This is an open-label trial and the duration of the treatment lasted for 14 days. So over 1,000 of patients were screened. However, a significant number did not meet the inclusion criteria or did not consent to participate. A total of 77 participants were enrolled in the study, and there were 39 participants randomized into the treatment group, 39 participants randomized into the control group. Study participants were followed up for 2 weeks. At baseline, the characteristics of participants were similar between the groups. There was no significant difference in terms of age, sex, severity of disease, and the timing of illness on enrollment. Presence of comorbidities and other treatments the participants received were also similar between the group. In intention to treat analysis, there was no significant difference in the duration of hospital stay between the control and the VCO groups. Subgroup analysis of moderate to critical patients only also showed no difference in the duration of hospitalization. In the per protocol analysis, there was no significant difference in the duration of hospital stay and the time of resolution to symptoms. Treatment of the VCO did not seem to alter the duration of symptoms of COVID-19, and analyzing the individual symptoms, there was no significant difference in the time of resolution of COVID-19 related symptoms between the two groups. There was also significant greater proportion of patients in the VCO arm who reported adverse events compared to control. The most common adverse events were diarrhea and abdominal pain. And for patients, adverse events were intolerable, which led to discontinuation of VCO administration. Although VCO has demonstrated antiviral and immunomodulatory properties in previous studies, more studies are needed to confirm the benefit seen in other trials. Exploratory studies on dosing regimen, the type of VCO formulation, including timing of administration, may be needed to determine the role of VCO in the management of viral infections, such as COVID-19. In conclusion, this clinical trial on hospitalized patients did not demonstrate significant benefit on the use of VCO as an adjunctive therapy for hospitalized COVID-19 patients. Currently, analysis of the effect of VCO on inflammatory biomarkers and biochemical parameters are still ongoing. Cytokine analysis is also being completed. Dr. Alejandria and the rest of the team would like to acknowledge VOSP,